Hi, I'm Mike. I'm 67 years old and a musician come record producer come general dog's body. The one thing that struck me about Dr. Tewari and his crew was that nobody was afraid to have an opinion. I met several consultants who would lay out everything in front of me, and I got completely confused by over-information. After Dr. Ash had completed his diagnosis, we went and sat there, and he just looked me in the eye and said, "It's got to come out." And that's the sort of strong opinion that I was very glad to hear. An important consideration for me was the after effects and quality of life. I didn't want to leak, and I wanted to have sex. Many consultants that I saw just sort of brushed it off. We'll chop it out, and that's it. Whereas Dr. Tewari and all his assistants looked at the whole person. They didn't just look at a little gland down here. And they were concerned about the whole person and what the whole person would be doing afterwards. I followed Dr. Tewari's recommendation for so-called robotic surgery, and since the operation I've returned to complete normality, and I think I was there within about 3 months, 4 months. It was quite confusing to go through the same experience at climax but not ejaculate anything. But it doesn't make any difference to the experience itself. Well, nobody wants to have cancer. The diagnosis was that I had, but since then it's been dealt with. And Dr. Tewari assured me that there's a very minimal chance of it recurring. And right now it's nice to know that Dr. Tewari is there if necessary, and he's there on a long-term reassurance plan.
A Dramatic Health production.